Assalamu alaikum, this is RPH Fia with the new topic of the quinolones. So let's begin the lecture. The prototype of the quinolone family is nalixidic acid. There are also four generations of the fluoroquinolones that are ciprofloxacin, norfloxacin, pfloxacin and ofloxacin are categorized into the first generation fluoroquinolones. The second generation fluoroquinolones are lomifloxacin, levofloxacin, pruli and sparfloxacin. Third generation fluoroquinolones are GATI, GEMO, SPAR and moxifloxacin. Fourth generation fluoroquinolones are trovafloxacin, allatrovafloxacin and fenafloxacin. Here you can see the bold blue color line, bold letters of blue colors, that is man can spot good life. What is the meaning of this sentence? Man can spot good life are the all drugs of the fluoroquinolones family. So you can learn the drugs of fluoroquinolones with this mnemonic. M for moxifloxacin, A for allatrovafloxacin, N for norfloxacin, C for ciprofloxacin, spot, S for sparfloxacin, P for pfloxacin. Then again P for prulifloxacin, O for ofloxacin and T for trovafloxacin. G, good. Good indicate G, that is GATI and gamifloxacin. Here also G count as 2, GATI and gamifloxacin. L also count as 2, that is lomi and levofloxacin. Here is the structure of the quinolones or the nalixidic acid. This is a basic backbone structure of the quinolone. Nalixidic acid is the first member of quinolone. After the fluorination of the quinolone, it becomes fluoroquinolones and it having the great activity against gram-negative mainly, but having the gram-positive activity like some new fluoroquinolones. Nalixidic acid having narrow spectrum of activity against the gram-negative. It is a bactericidal act by DNA grace inhibition, highly protein bounded, high concentration in the urine, neurological toxicity, vertigo, visuals and seizures, hemolysis in the G6PD deficiency, use as a urinary antiseptic, bacterial diarrhea. Don't give with nitrofurantoin. Why? Because it can cause antagonism. First generation fluoroquinolone, that is ciprofloxacin, most common use fluoroquinolones. Ciprofloxacin having the long post antibiotic effect, less active against acidic pH, interact with the food and calcium, so not administer with food and calcium. High tissue penetrability except blood-brain barrier. High concentration in the urine and bile. CNS side effects are common like seizures, tendinitis and tendon rupture is the mean ADR of the ciprofloxacin. Drug interaction, inhibition of the metabolism of the other drug, chelation, QT, interval prolongation. Here are the uses of fluoroquinolone. It can be used in ophthalmic infection. It can be used in the infection of the bones, joints and the soft tissues. It can also be used in the GI and the abdominal infections. It is used in the respiratory infections, mycobacteria, inhaled anthrax, prostatitis, UTI and STD. Its mechanism is inhibit the DNA grace and topomerase 4. DNA grace is also known as topomerase 2, bacterial topomerase 2. It having the bactericidal activity and it can be given via oral and IV route. Its adverse effects are tendon rupture, pregnancy, category C, it is in the category C of pregnancy, seizures, prolonged QT, dizziness, confusion and photosensitivity. Uses of the ciprofloxacin are central nervous system infections, microbial foodborne illness, osteogenesis imperfecta. This is basically the inherited genetic bone disorder, ear, nose, throat infection, respiratory tract infection, gastrointestinal tract infection UTI, urinary tract infection, pelvic inflammatory diseases, sexually transmitted diseases, and small bowel injury. It can also be used in the nosocomial infection, that is hospital acquired infection, septicemia. It can be used in tuberculosis, multi-drug resistance tuberculosis, and extended drug resistance tuberculosis. Typhoid. In the typhoid, 2 weeks treatment can be given. Prevention of carrier stage 2 months